great. Let's get started. Again, I want to welcome you to the Azalea Health February at Lunch webinar, and we will be talking today about pre-certs. It's all about pre-certs. And what can we do to help you with your pre-certs? We're now offering pre-cert services and getting a great response to that. We've got two great panelists today, including Serena Metter.
Hello,
Serena. How you doing?
I'm good, Tamara. How are you?
Good. Serena worked as a surgical coordinator and practice manager for a surgeon's office, as well as with two surgical assisting practices. She has a lot of great frontline experience in credentialing with hospitals, insurance companies, and pre-certifications for multiple specialties. So we're very fortunate to have her today. She's also been playing a great part with helping us with our pre-cert strategy and program. And then we have Romeen Haksad, who is our channel manager at Azalea Health, but also has been taking the lead with our pre-certs program. Romeen also has worked with a number of clients and partners and customers on the front line with industry challenges. Romeen, hello. How are you doing today?
Good morning, Tamara. It's a pleasure to speak with you again.
I'm having a little hard time hearing you, Romeen. Can you speak up a little bit or make sure your mic is close enough?
Yes. Can you hear me better, Tamara?
Yes, that's better. Great. Okay, let's hop into today's agenda. So very quickly, what we're covering today is, first of all, what are the challenges? We're all pretty intimate with those challenges and managing the pre-certs in-house. Second, what are the benefits then of outsourcing your pre-certs? What is the cost equation, the in-house versus the outsourcing? And we've got some comments from some of our clients who are using our pre-cert services. And then Romeen will take a lead and a brief demo of Azalea Health Pre-cert Services, and then a few pointers on how to get you started with that. All right, Romeen, you've been on the front line, you and Serena both, in these practices and seeing what a challenge it is to manage these pre-certs. What are some of these challenges? Can you give us a brief overview of that, please?
Yeah, I consult with practices on a daily basis, and a lot of time we go over the workflow and how their staff as well as the physicians can be more efficient to cut costs and really streamline operations. And the number one complaint that I've been getting over the past year has been dealing with pre-authorizations. And this has been a pain for a lot of different specialties that I've dealt with. And Serena, being that you've really worked these, what are some of the different, I guess, things that you've been hearing and dealing with over the years as well?
Well, Romeen, just from my personal experience, I was, as a practice manager, responsible for pre-certs for all of our procedures. And when you're talking about a specialty that happens to require a lot, you can be spending 15 to 20 hours a week just trying to process these prior authorizations from beginning to end, and obviously every second counts, and that's time spent away from other responsibilities. It's time spent away from patients, and the follow-up alone is extremely time-consuming. We also have situations where the procedures aren't completed in a timely manner because the prior authorizations haven't been done.
Yeah, I get a lot of feedback sometimes with practices that are telling me that, you know, they don't have a dedicated person. They're throwing it back on different staff members from, it could be anyone from the front desk, the biller, or even a nurse. And a lot of time these staff members don't either have the resources, the time, or the manpower to really give it its all. And this is really affecting the AR for a lot of different practices that I've worked with.
It definitely does. It can affect the AR in such a negative way because they're not getting done, therefore they're not getting billed, or if they're done incorrectly or not completed on time, then you have a procedure that's done and doesn't get paid. And a lot of times it's not just the front desk staff and the office manager. It can be the surgery schedulers, and they are extremely busy just trying to manage the patient from beginning to end with a procedure, and they don't really have the time to be spending on the prior authorizations.
Exactly.
Great, thank you. So we understand the challenges. So why aren't more physicians and practices exploring the options and outsourcing the pre-cert process?
Well, I can answer that, Tamara.
Oh, sure.
I think that there's a tremendous fear of loss of control. When you're talking about outsourcing, I think the physicians feel like putting it on the responsibility on someone else They're losing control of the process. They're worried that they are not going to have a dedicated person. They're also worried that things are not going to get done, and they're not going to have someone that's experienced or knowledgeable about their specialty that's going to complete this pre-cert.
Yeah, I completely agree. And working with these different organizations, from surgery centers to family practitioners to different specialists, I think that that's the biggest fear that you hear from practices. But at the same time, those same practices are now outsourcing their billing, and it's something that as the market changes over the next few years, you're going to see more practices not only outsourcing their billing, but they're finding other functions within the office that they're seeing can really make the staff more productive and save money in the long run.
Thanks, Ramin. Is it fair to say that as the environment and administration becomes more challenging, and for example, we have customers who are outsourcing their billing, they're going to have to become more comfortable with outsourcing some of this administrative stuff so they can focus more on their patients? Are you seeing more of that?
I would say that, yeah, I agree with that 100%.
Yeah. Okay, then. So we understand the challenges. All right, then. So what are some of the benefits of outsourcing, and what are you seeing out there? Ramin, you want to start with this?
Sure. I'm really seeing that one of the benefits of using the Azalea pre-authorization portal is that no matter where the physician, the staff is located, all of them can log in at their convenience from anywhere that they have internet access. And I think that's a very powerful thing that practices don't realize that they're missing out on. You have providers that are constantly on the go. You have staff members that may be working full-time or part-time, and being able to know if it's being kept in the cloud where it's accessible, it's also HIPAA compliant compared to keeping it on, as an example, an Excel sheet. That's the number one thing that I'm hearing right now is, oh, the office manager, the nurse is keeping it on an Excel sheet, and if they're not there, if they're out sick or having to take the day off, no one knows what's going on with that pre-authorization.
I completely agree with that. That's exactly what I did. I maintained the status of our prior authorizations on a spreadsheet, and it wasn't accessible from anywhere, and there were too many hands in the pot, so to speak. So there was too much room for human error,
right,
with too many different people getting into that spreadsheet and changing statuses or updating. So from what I've seen from the Azalea Pre-cert service, this one screen that you can log in from anywhere to look at, you can immediately look at all of your prior authorizations and see the status. It's just phenomenal, so there's no question. It's much faster to handle things that way.
So essentially we've streamlined the process. We've made it simpler. We've got this one screen where you can manage everything and see everything at a glance. But I also know from my own experience, I have a background working with payers, that stuff is changing all the time. The requirements, regulations, and that claim rejections and errors, there's just so much you have to deal with that it can't help but be a relief to have somebody who understands what they're doing manage this for you. And the bottom line is improved staff productivity, as well as bottom line for us all is greater patient satisfaction. Would you agree, Serena?
Absolutely. It's like a one-stop shop. Instead of going to 3 different websites or making 4 different phone calls to try and get the status of several different prior authorizations, you log in, you can see every single one, no matter the payer, right there. You're able to schedule surgeries faster, because you simply have to input your information and your prior authorization is done, as opposed to waiting until the next day or when you're done seeing patients to start those prior authorizations. It's just improves workflow tremendously, and it definitely creates more time for the staff and the physician to pay attention to patient care.
When we talk to different practice and providers out there, we really tend to tell them it's very much like a clearinghouse for pre-authorizations. It's one location, and I think that's really something that really connects with them. They see their staff having to fax to multiple different fax numbers, go to multiple different websites, call different phone numbers, and then you have staff turnaround. And that's something that can always cause issues within an office. You have the one person that you have trained and knowledgeable. If they move on to another career or work at another office, that is really affecting the practice, not only financially, but how they can see their patients and deal with them. So I think knowing that you're always having someone, having a team here at Azalea that has the knowledge and the know-how, and knowing that you can reach out to them at any time and ask a question and feel like you have somebody that's an advocate on your side is very powerful.
Exactly, Romaine. And as we said earlier, one of the holdouts for our physicians and clinics is a lack of trust in this resource having that level of knowledge and experience. So can you tell us a little bit, Serena, why should they trust this dedicated authorization specialist? What's their background, and why should they rely on this person?
Well, this person is, this is in essence their function. So their only function is to process these prior authorizations. So they're keeping up with industry requirements. They're changing every year.
Yes.
Procedures, more and more procedures are requiring prior authorization. And this is what they do, as opposed to someone in office who has 20 other responsibilities that are being neglected or not kept up with because they're having to deal with this. So when you have a team of people, really, which I feel like is exactly what Azalea is able to offer, that is dedicated only to your prior authorizations, to me it's a no-brainer. Why would you not want that resource on your side?
Yes. All right then, thank you guys. Let's go on to the next discussion then, which is on, we have to admit, the first holdout for everybody is the cost consideration. So how does this save them money? Can you talk to that some? You want to start, Romaine?
Yeah, that's a great question I get from almost every practice provider, organization, even hospital I speak with. And it's really going to range on what you're paying that employee. I have everyone from nurses getting paid $35 to $40 an hour that are handling pre-authorizations to staff members that are getting paid between $15 and $20 an hour. And it's one of those that when you take a look at how long it takes a staff member to accomplish a pre-authorization, it could be 20 to 30 minutes on the front end, another 15 to 20 to make sure that it's kept up with and phone calls are made and receiving that authorization number. You could be paying somebody $35 to be able to handle one pre-authorization or $20. So a lot of offices don't recognize the cost that goes into paying that employee to be on the phone or to be handling documentation when they should be doing other functions within the office. The biggest thing that I think that we can offer is that it's a flat rate per pre-authorization. The portal is completely free. We just charge per pre-authorization. If 1 month you have 7, the next month you have 49, it doesn't make a difference to us. We're here to assist you with that number. So if it fluctuates, I think that's something that makes it that much more beneficial, is that you don't have to worry about it fluctuating and hiring somebody on staff and paying them weekly or monthly to be there and not knowing what comes week to week for your pre-authorization.
Right. Thank you, Ramin. And I know, Serena, you and I were talking earlier about this, about sort of the time equation and how that relates to the cost equation. So can you run through how long does it take an average in-house resource to process a pre-cert versus the Azalea portal option?
It can take, as Ramin stated earlier, half an hour to an hour to complete one prior authorization from beginning to end, and that's really truly considering things go somewhat smoothly, that information isn't lost or you're told by the payer that it wasn't received. In those instances, you can be talking about an hour and a half to 2 hours. Whereas using the Azalea portal, you are literally talking about 5 to 6 minutes of simply inputting some demographic information, insurance information, and uploading your clinical, and then you're done. You simply need to log in and check your status once a day or once a week or what have you, and that's seconds of time is what you're spending. And then, this is for people that are just portal users. If you're an Azalea Health EHR client, you're talking about 3 minutes or less because that demographic information is already loaded into the system. So right. one pre-cert per hour versus 10 per hour, that's a huge cost savings.
And right, and as we all know, being in a small staff, a small office, you never know how many distractions or other priorities are going to take priority over this process. And we know that happens constantly.
All the time, right. This is assuming that a staff member has the hour to sit down and dedicate to do this, which never happens.
Thank you, Serena. Okay, so a few comments from some of our clients about the pre-cert process. Relying on Azalea to manage our pre-certs makes life simpler, and we have better workflow now. Outsourcing our pre-certs to Azalea enabled us to get more done and reduce paperwork so we can focus more on the patients. the summary screen, and I think this is from Serena, who when she first saw it was amazed at what a great, she said it's brilliant because she can see everything at a glance
Yes.
that's going on in this. Can you tell us about that, Serena?
It's just I was using a spreadsheet, as I said before,
Oh,
and
boy.
to be able to open up the Azalea portal and look at all of my prior authorizations for every provider at one time was just amazing. It was revolutionary.
Yeah.
It was revolutionary to our workflow and to my life.
Right. And of course, the bottom line for all of us in this industry is, as you said earlier, Serena, every minute saved means we can spend more time with the patient.
Correct.
So that's what we're all about. Okay, Ramin, you ready to give us sort of a glimpse of the system here? And this is just to give you guys a quick glimpse of what it looks like in Azalea Health. If you want to see more, you can contact Ramin or us, anybody here at Azalea Health, for a demo, a full demo of how it works. So Ramin, I'm going to let you jump in and show us this great at-a-glance screen, which shows us everything that's going on.
Thank you so much, Tamara. So what we're taking a look at right now is the home screen of the Pre-Cert portal. So this is where you can really, at a glance, like Serena was talking about, see where your pre-certs are sitting. You can see a green bar kind of across where it says the name of the patient, the location, provider. That, with just a click of a mouse, can be resorted. And we even above that have kind of like an ad hoc where you can, if you wanted to look at one provider for a specific payer at a specific location and even a status, it's all right there at your fingertips. And so we have about 7 different statuses that these pre-authorizations can fall in, from new to peer review to in process. And you're able to log in as a office manager, as a biller, as a physician, to take a look at any time and see where that pre-authorization is and what status that it's in. And if you want to go ahead to the next page for me.
Okay. And I know Ramin, he gives a lot of these demos to folks. He's probably itching to get his hands to move us around for you. So like I said, just you can give him a call and he'll set up a demo for you.
Yes.
All right, and this next screen shows adding a patient.
Yeah, so it's really as easy as hitting new patient, and these are the different fields that we have. There's going to be some minimal requirements when you open up the demographic portion, but it's very easy to be able to open up certain information from their primary insurance, secondary if they have it, as well as their general demographic information. So it's a one large page, pops up right in front of you, very easy to fill out and manipulate. So you can grab that information quickly and move forward with the pre-authorization process. And if you could go to the next slide, please.
Great. Thank you, Ramin. And next, I'll let you describe this.
Wonderful. So as you work down the pre-authorization, at the top of this page would have been the patient's demographics. And as you move down, you can see you have options to be able to manipulate the rendering provider, the date requested. You can, we will have all of your locations as well as place of service uploaded within the software. You have the ability to add diagnosis and procedure codes. What's really nice is that you have a search function where if you needed to actually search for the code and look for more of a descriptive one or make sure that is the correct one, that is already built in within the software.
Correct.
At the very top of the page, you can see also the different status. You can see how it says incomplete. There's different statuses that will fall in. And then we have some other functions on the next page that I'm going to point out as well. So
I had a question here, Ramin, that I'm sure others have. Is at the top, of course, you see it says Azalea EHR. So let's say to our existing Azalea EHR customers, what would they need to do to add this functionality?
So for any existing EHR customer, all you have to do is call into your sales representative or support, and they have some minor paperwork to fill out, and this is something that can easily be turned on right within the EHR. For anyone that is a non-EHR user, we have portal access where we can flip on a portal for you to have access to. Again, it's all HIPAA compliant, and again, you will be able to log in from anywhere you have internet access.
Oh, great. Thank you. Okay, let's move on to the next screen.
Perfect. So up at the top arrow in red, you can see where it's kind of pointing out where you can upload or scan documentation. So any clinicals that may need to go along from documentation or even images can be uploaded or scanned as a part of that pre-authorization. Down where the bottom red arrow is, you're going to be able to see where at the bottom it says add a note. So if you needed to add any notes for any of the staff members to be able to have more information on this patient's pre-authorization. You're able to add notes there. And kind of at the top, that is where the staff member would be able to add notes or respond back to you. So we have a great way of being able to communicate back and forth.
That's great.
And that's really a great outline right there for you.
Thank you, Ramin. And moving on to the next.
Once the information has been submitted and saved, you're going to obviously want to come check back in for that pre-authorization number. And this is a pre-authorization that has been worked, and where that arrow is pointing out is to the pre-authorization number. You can easily come in, you could copy and paste and pop it in if you're using just the portal and you need to put that back in your own personal practice management system. Otherwise, this would be saved in if you are using the Azalea EHR. So it'll be available right there for you.
I love this view because you can see all the insurance information, all the pertinent information you need right there in one form.
Exactly.
And I want to point something out here too that I think is great. At the top, on the top right, where you see pre-cert files, it's a fabulous area to save your fax confirmations from the insurance company.
Mm-hmm.
Those have to be filed somewhere, and it's fabulous to just be able to pull it right here.
Wonderful. Thank you for pointing that out.
Mm-hmm.
Okay, great. So that's the last of our screenshots. So for people who are attending and listening to this, Ramin and Serena, what would you suggest their next steps are if they are interested in following up on outsourcing their pre-certs? What should they do first? Who should they talk to?
Yeah, I think the best thing to do would be calling in and speaking to any of the sales representatives here at Azalea Health who are knowledgeable and able to demonstrate this portal, or even if you are a current Azalea Health user. It's something that we would love to kind of go a little bit more in depth with you, go through the workflow, talk about kind of the steps that you currently do within your office, see how we can replicate those or fit those as best as what you're currently doing right now.
Great, thank you. All right, moving on then, we're going to, whoops, what's this doing? There. Now we're opening up the floor to questions. Questions from the audience. If you have any questions about pre-cert services, in-house versus outsourcing, enter your question, whoops, into the chat field there, and we'll answer those questions. I've got a couple coming in. All right, Ramin, let's see if you can take this one for us. We've got somebody asking, why would you choose Azalea's pre-cert services over a cheaper competitor? Whoops.
No, that's a great question. Look, there are going to be some competitors out there. The biggest thing that I've learned in life is you pay for what you get. You know, we're offering a premium service, and you're going to be expecting premium results. You're paying for a very educated staff, as well as a very easy-to-use portal. And for only, on average, $7 per pre-authorization, it's a great return on investment for any practice.
Great. Okay, we have some good questions coming in. Do you only pre-cert surgery cases, or do you do in-clinic procedures also?
Serena, if you want to take that one, since you have a lot of experience.
Yes, you know, absolutely. In-clinic procedures can be done as well. Any procedure, surgery, medication that requires a prior authorization can be handled through this.
And I was going to encourage our listeners also, if they go to our website, we do have a page on our website that describes sort of all the functionality and features of the pre-cert services. Okay, next question, of course, how much does it cost per PA?
So that's a great question. So we just charge per pre-authorization. Again, we do offer volume discounts, but an average pre-authorization is about $7. So
Great.
We do not charge for you to have access to the portal. The portal is completely free, and we just charge per pre-authorization.
With that, do they get that great one-screen management with that?
Exactly.
Okay.
That's a real big benefit that they're able to receive for free, is being able to track all of that very with at a glance, being able to manage it and sort it, and again, being to do that where you have internet access and not worrying about storing it on a spreadsheet on somebody's computer. That's really powerful just by itself, that you get for free.
Another good question, is the cost based on CPT code or date of service for a patient?
No, the cost is not based off the CPT code. It's going to be based off of just the submission of the pre-authorization.
So it's a flat cost for the process. It has nothing to do with CPT codes or the date of service.
Exactly, just a flat cost for the pre-authorization. Again, it's for each pre-authorization that's submitted through the portal.
Okay, good question. This is something we may want to add to our website. Is how long is the implementation process, and what is the staff training component if we decide to use this?
That's a great question.
Yeah.
So it takes typically about a week to 2 weeks. It really just depends on typically more on the office of being able to have time to be trained. The training of it is literally 20 to 30 minutes. Most practices already know how to do a pre-authorization, so it's really just teaching them how to use the portal.
The tool.
Yeah, exactly. What we usually do is there would be some documentation that we would have, a form of a contract agreeing to the terms. There's going to be some other documentation that we need, and then once we have that, we try to upload all of that into the portal, so you have the different locations and place of services in there, as well as different providers. Once we have all of that preloaded, we can typically get a practice up and going in 1 to 2 weeks.
Great. Serena, can you comment on that? 'Cause I know you've been through it.
I can. One thing I can definitely speak to is the ease of use of this portal. I mean, truly, you can almost self-teach. It's so self-explanatory and simple, which is great. I would almost say that the staff training is the shortest process in the implementation because it is so user-friendly. And then everything else is just basically the paperwork. I mean, it's just a really extremely user-friendly system.
Great. Okay, let's see. Another, do you pre-auth diagnostic testing procedures? Do you pre-auth diagnostic testing procedures?
Yeah, Serena, if you want to hit on those with your experience, you can answer those a little bit more fluid than I will be able to.
Yes. The diagnostic procedures can be done. I mean, in essence, the submission of a prior authorization, whether it be an in-office procedure, a surgery, medication, the process is basically the same. You may be dealing with a different department, let's say pharmacy versus care coordination, but the process is submitting the actual authorization is going to be the same. So everyone at Azalea is going to be familiar with those processes for all the payers.
Mm-hmm. Great. Okay. What is the typical turnaround time when an authorization is requested?
You know, that's a great question because it can really vary.
Yeah.
It's something that some can be turned around. A lot of them are turned around in 72 hours, 48 hours. Again, others could be surgeries, and they could take weeks for it to get pre-authorized. So it really is going to just depend on the specialty as well as the average time it usually takes.
Right. There's so many parameters.
Mm-hmm. Exactly.
Right. That's really based on the payer and the type of service that you're talking about, whether or not that service requires a nurse review, et cetera. So Azalea really is not the monitor of the time in essence. It's going to be the same as it would be for anyone else doing it because it's the insurance company that you're waiting for.
Right.
Exactly.
Okay. Good question again. Do you require a contract? If yes, how long is the term?
Yes, we do require a contract for this service. It is a 12-month contract with a 60-day out at any time.
Okay.
So we want it so you can get up and going, try the service. If it's a great fit for you, we keep it going, but we give you an out with no penalty at any time.
Oh, great. Okay. That was the next question. Does the service do pre-authorization of DME products as well?
Yes.
Yes, that can be done.
I'm sorry, Serena.
That's okay. No, I was just going to say yes, that can be done as well.
Okay. Next one, let's see. What does that mean? I was trying to read this. Current company using at this time. I'm not sure what that means. Okay. We already had that one. How quickly is the request worked then when the auth is submitted? Okay, I think we covered that briefly in the webinar, but can you cover that again, please?
So once it's submitted, it's going to be picked up. We try to have it picked up usually within the first few hours. So once it's submitted, we do have resources here that are going to be taking a look at it. So it should be touched usually within the first few hours of it being submitted. And touch means it's going to be acknowledged, and they're going to be starting the process.
Okay. All right. A few more questions, then we're going to have to cut people off. This is a great response. Let's see. Serena, if the pre-cert is denied, will the pre-cert service handle all appeals?
So that is a a great question. So there's several options that can be done here. You can give, basically what will happen is the client will be notified that the pre-cert was denied, and then the client needs to take it to the patient and let the patient know and decide what they want to do. Do they want to turn around and pay out of pocket for that? There is sometimes a peer-to-peer that can be done, and that would be a client preference. So in other words, if the clinical doctor at the insurance company needs to speak with the surgeon, that phone call just needs to be initiated, and that would be, again, a client preference, whether or not they want Azalea to handle that or whether they want to handle that themselves.
Right, right. Okay, I think we can take one more. With all the pre-certs worked, oh, wait a minute, will all the pre-certs be worked or only pre-certs for certain insurance?
No, it's all authorizations will be worked, regardless of the insurance company.
Okay.
Yeah, regardless of what state or payer, we're able to accommodate all.
Okay, great. All right, we're getting to the close of our time for this. We've had a great response, great questions, and I want to thank you, Serena Metter and Ramin Hakzad, for your contributions to this webinar, your knowledge, and it's been a good discussion, great questions. I also want to thank our audience for joining us today and remind you that in Thursday, March 25th, we have our next At Lunch webinar, and we'll be discussing the ramifications of a survey we conducted recently on health IT for rural and small clinics and hospitals. If you'd like to register for that, the information is up on our website now. But again, contact us at marketing@azaleahealth.com if you have any questions, and call Romeen at 877-777-7686 if you'd like to request a demo of our pre-cert services. Thank you, and everybody have a great day.
Thank you, Tamara.
Thank you.